Parkhaven Trust was established in 1888, so we've been around for a long time, and it was the first service, first residential service of people with epilepsy. So quite an innovative service in its day, and we've continued to change and develop since that time. The latest development being our new nursing home called The Beeches. We wanted to achieve a better experience for the service users and for the staff, because it's not an easy job that they have. So we had the advantage of a new building, and in looking at that building, it was very easy to just do what we did in the past in a brand new building, but we didn't want to do that. So we were fortunate that we had the opportunity to do that. And we looked at best practice. So John, who's our estates manager, went on a course at Stirling University on design and came back full of ideas of how we could improve things. Lots of technology solutions to managing a care service. I subsequently went on something similar, but not as in-depth. Mine was only kind of a day, and saw lighting and saw circadian lighting and thought, this is amazing. You know, this absolutely makes sense. It absolutely makes sense that people get a good night's sleep. So we're going to talk about that. And then in terms of the acoustic monitoring, what we wanted is staff to have the opportunity to change their practice at night. So we knew that it was important, and probably one of the most risky times in a 24-hour period, night shifts. So that's where we were having falls at night, and where we have incidents, you know, that every care home has. So somebody was disagreeing with somebody else. We just wanted to make sure that we had good practice at night, really. So the acoustic monitoring allows us to do that. And the system that we've got is linked to our CCTV. It's linked to the door entry system. It's linked to the nurse call system. So everything comes together in one piece of kit, really. And then in terms of mobile care planning, that was about making sure that we had accurate records, because it's classic that if CQC come round, the first thing they say is, if it's not written down, it didn't happen. So we have to have a foolproof way of making sure that we record everything. And that's what we want to show you. We looked at technological solutions because we wanted the best care that we could provide in a new building. So we didn't want to do what we've done in the past. And it's mind-blowing when you look at it. I mean, I'm a bit of a Luddite, really, but I understood what the end result should look like, and that's where I came from. So I wanted it to be something that would make the job easier for staff and would give the service users a better experience. And they were the two drivers for me. It was the best solution for us because following the initial investment, it would actually save us money in the long term. So to get what we wanted, we would have had to increase our staffing significantly. And first of all, it's difficult to get good staff. You know, it's not easy to get good staff. And secondly, for a lot of the time, they wouldn't be doing what we wanted them to do, which is spend time with people. Circadian lighting is the lighting system that we've installed in the Beeches, and it works with the circadian rhythm of your body. So it replicates the normal light that you would have through 24 hours. The idea of introducing that is that it helps people to regulate their sleep patterns predominantly. And also, if you ensure that somebody has a good night's sleep, then they're more awake during the day, they can take part in activities, they can eat better, and they can take their medication more effectively, and the medication is absorbed, and they get a good night's sleep. So acoustic monitoring allows us to monitor the service users throughout the day, and particularly at night time. So we've installed that to help our night staff particularly to support people that need to be supported that are not asleep, and to make sure that those people that are asleep are still cared for. Traditionally, we've had a regime of going into everybody's bedroom at so many occasions during the evening and the night time. We don't do that anymore. So we're not disturbing people. So classically, a carer would go in, the light would come on, and the person would wake up even if they weren't awake, so that we could check they were okay. The acoustic monitoring allows us to do that without going into the room. So we can hear and we can see what's going on all the time that that's set. and individual sleep patterns are set, and we record those. And then if there's any change to that, it's alerted through the system. So the system alerts to a change in the normal sleep pattern. So everybody's different. We had to set the sleep patterns for the first couple of months that we were in the new building, and then you know what is normal for you or me. And if anything's abnormal, then that alerts a signal to the staff. And we can hear what's going on. So if somebody can call out, and they can ask somebody to come and support them if they need to. And again, that raises an alarm for the staff, and they can go into the room and check that everybody's okay. And we also introduced mobile care planning. We introduced that into the service when it was in another building. So we had a period of about 4 months for staff to get used to that before they moved into a new building. So they were quite comfortable with that piece of the technology before we moved, which was very important because we didn't want anything to stop the move going smoothly. And if staff were having to deal with that as well, it would have been difficult. So that allows staff to spend more time with service users. Traditionally, there had been frantic copying down notes at the end of the shift. Oh, what did you have for your lunch? Oh, we need to make sure that we write that down. And no transfer of that information onto a bigger picture. The system that we've got now records at the time when any intervention is made, no matter what that intervention is. And then that's all loaded onto the system for that individual person, onto their care plan. And then from there, that triggers alarms to do something else. So if somebody's weight is falling, for example, it flags up that somebody's weight is falling, and that flags up the need to do something about it. It also links all of the different inputs together, so the manager and her manager can look across and audit what's going on. So the manager of the service can audit all the interventions and say, hang on, there's a red flag here. We need to see what's going on there. Or why haven't this particular intervention, why has that not resulted in any action? So again, if it's a weight issue, okay, we need to get the SALT team in. We need to look at what's going on. We need to see what's actually happening with that person, rather than thinking, oh, it's the month when I need to look at everybody's weight. So it's much easier to keep a handle on what everybody's doing and to react much quicker to anything that needs to be reacted to. The biggest thing it does is save staff time, because they're not having to, first of all, remember something and then go and write it down somewhere, and then reconcile all of that information at the end of the shift, at the end of the week, at the end of the month. It's all there and it's reconciled as you go along, basically.
All of the systems at the beaches are integrated. For example, the acoustic monitoring, nurse call and electronic care planning systems are linked to the handsets that all care staff use. This means that staff can see acoustic monitoring alerts on the same handsets used for care planning. They can automatically record that alert and their response to it, saving time and improving accuracy. Managers and specialist teams also have access to a digital dashboard where they can view key information from the systems. This enables them to identify residents in real time who may need additional support, rather than waiting on a standard cycle of reviews. All of the systems at the beaches collect and record some level of personal information, so managing consent and data protection is important. Parkhaven makes it very clear to those considering moving into the beaches that circadian lighting, acoustic monitoring and electronic care planning and their related data collections are part of the care package. It's included within the service agreement. Rather than deterring people, relatives and potential residents actually approach Parkhaven because they have this technology. Acoustic monitoring is only used at night to alert staff to residents' needs during sleeping hours. They are switched off whenever residents are receiving personal care, such as getting changed. And all audio and visual recordings are deleted once staff have attended to the residents' needs. The fact that an alert has been raised and managed is noted on the electronic care plan, but not an actual recording of the event. The handsets that care staff use to access records only work within the beaches and with the apps approved by Parkhaven. Parkhaven Trust has robust privacy and data protection policies covering all of the systems that collect, store or share information about their residents and staff.
We looked at who were the best providers, and we took that to the project board, and the project board decided, which had a member of the trust board on it, and it had staff on it. So managers were on that. Once we'd agreed that bit,